Welcome to the European Association of Urology's Annual Congress here in Munich.
It's great to see so many friends, colleagues, members and guests present, so I hope you enjoy the meeting.
This year's conference is important for a number of reasons. First of all, we are hitting the record of participants. There are already more than 13,000 people attending the conference.
I came to the European meeting to see my friends from all over the world, to know what's going on in urology.
I'm from Canada and I'm actually really excited for a conference to learn about everything from a European perspective. It's my first time here.
We can meet a lot of the people that we see in the books in which we are studying right now. And so it's one of the best experiences for me in the urological field.
We did receive more than 4,000 abstracts this year, telling us that researchers worldwide consider this forum as the top one to present what they do during the year.
The drivers, the engine, the mutations that are driving the behavior of this cancer are different. So the idea is now to go, instead of going from the outside and treating, is to go from the inside.
I do think we have to speed up matters in order to save every patient that is coming today, tomorrow, and the day after tomorrow.
I think we're at the cusp of a revolution. We, I think, have shown that we can selectively treat the prostate, get rid of the cancers, and do so with very little risk to the individual.
We have learned that genetics is probably more important than we used to think.
We're not more important than a bacteria, and we're not more stronger than them. We're on an equal level. Then we understand how to deal with them better.
We found a 17% decreased risk of prostate cancer-specific mortality among statin users and a similar reduced risk for death of all causes.
The title of my poster is Feasibility and Efficacy of a Urologic Profession Campaign on Cryptorchidism using Internet and Social Media.
The subject of our study is a rather large-scale study of varicocele in the general population.
The title is Urinary tract stone is an independent risk factor for stroke. In this meeting, we can spread this information to all urologists around the world.
Within the context of the European Commission, I think it's certainly possible for these guidelines to be considered for inclusion within the broader European context as being the evidence base which dictates appropriate and ideal practice.
We do evidence-based practice where we rely on high-quality evidence to determine how we care for patients. And that's the way that we should be going.
We have to be open to the idea that things change and there will be new ideas, and we have to accept them as the evidence comes in.
And it's also very important to cater for what patients think is important. So within that context, we have patient representatives on the guidelines, and we're also developing, based on the guidelines, patient information.
What we need is guideline-based, unbiased, reliable information for our urological patients to enable them to understand not only their disease, but also when talking to the doctor to ask the right question.
I looked at the laparoscopic surgery, robotic surgery, prostatectomy and partial nephrectomy.
You get to see experts operating, to see some tricks that they use that you don't find on textbooks.
Good surgery, good surgeon, good performance.
EAU will be in London next year. We'll see you there.